A good story, you never feel like you've had enough of it, right? Right, so we're going to, please have your seats. I wanted you to stretch your legs. All right, okay. All right. Yes. So we'll take a photo. Okay. All right, thank you very much. Thank you, thank you. Okay, as they exit the stage, we'll be moving on to our next very important and interesting panelists. Professor Elizabeth Bukusi is with us. Professor Elizabeth Bukusi. Welcome to the stage, Prof. Karibu sana. Let me tell you a little bit about Prof. Elizabeth Bukusi. She's a highly accomplished healthcare professional and researcher. She holds very many academic accolades, from a medical degree, an M.Med, obstetrician gynecologist, with a master's in public health, a PhD, she's a doctor 2 times, and a postgraduate diploma in research and ethics, and a fellow at the African Academy of Sciences, right? She is currently a senior principal clinical researcher at KEMRI, which is the Kenya Medical Research Institute for the country. And she's a professor in very many academic institutions. So with a warm round of applause, let's put our hands together and welcome Prof. Bukusi. Karibu sana. From the other side of Africa, in the West, pharmacist Abimbola Ajayi. Please welcome on stage. Karibu sana. She's the Director of Pharmaceutical Services at Massey Street Children's Hospital in Lagos State, Nigeria. She has led teams to exceptional pharmaceutical care and medication management, quality improvement. She has dedicated her career in patient safety and quality improvement in pharmacy. Her involvement in various QI initiatives across Lagos State since 2015, and her role as a certified coach in QI and a mentor since 2017 has earned her several awards. She has coordinated a pilot proof of concept in Lagos Health Insurance Scheme and applied numerous QI methodologies in neonatal care, including, and she's had several recognitions for these initiatives, including a visit from Bill Gates. She is also a QI facilitator at Nest 360 initiative in Nigeria, supported by the Bill Gates Foundation. Ladies and gentlemen, a warm round of applause for Pharmacist Ajayi.
As Dr. Carolyne transitions to the panel, allow me to bring in the online community as usual. Please keep your chats flowing. We are really excited to look at them. Forgive us when we are not able to read them out. Just remember, we are going to collate everything here into a position statement. You'll have a chance to review it and provide your feedback. So everything that you're writing here is actually going to be taken into context. So over and back to you, Dr. Carolyne. Thank you, online people. Please remember that we will give you a short time to put up your hand and unmute. Dr. Carolyne, please keep that in mind. This session is ending before 1:30. Thank you.
Thank you, Ruth Pal. And welcome to this session. So this session, We're going to be talking about coaching and mentorship, in quality improvement and patient safety. Coaching and mentorship. It came out in several discussions yesterday. It has come out even in the previous discussion today. The importance of this kind of an approach in building capacity for QI leadership. And you've heard how strong this panel is in building capacity in healthcare, in our healthcare system. So we want to talk about this approach and why it's why we think it's a good approach, or whether it is or not. Why we think it's a good approach to improve the quality of our healthcare system. So we'll start with Dr. Bukusi. We just want to hear your story in 4 minutes or so, and how mentorship has influenced your career in the healthcare space and your work in healthcare space, providing healthcare services, teaching and building capacity, and even in research. How has mentorship and coaching built that?
Thank you very much. It's an honor and a pleasure to be here with you this morning, and an honor to hear about all the many people who are joining online. Let me try and make sure that I keep to less than the 4 minutes that I have been given. We need to think about what is mentorship, what is coaching, and how does it differ from other forms of supervision that we are aware of. When you talk about mentorship, it's not supervision. It's not about just ensuring people deliver a certain product or a certain number of action items within a specified time. It is about a life experience where one leads by example. Mentorship is about helping someone become the best that they can be in that circumstance. Coaching is about giving them the skills that they need, enabling them to have a safe space that allows them to be able to do their best and identify. Now, what's the difference? When you mentor someone, it's a place where you have experience in the particular thing you're mentoring them in, and you're showing them, this is the way I did it, maybe this will work for you, follow it, and do this. When you're coaching them, on the other hand, you're finding out where they want to go, and then helping them discover the skills they can use to get there. So it's slightly different. For me, both coaching and mentorship have been very important in helping me get to where I'm at. It's about the people who've gone before me, who have shown me by example how they have gotten there. But it's also about creating a safe space for me that allowed me to find what are my skills, what are my interests, how can I best get to the place that I need to get to. These are critical if we need to be able to develop quality improvement as a key way in being able to deliver good services to improve health with the limited resources that we have in this part of the world.
Thank you. That's been amazing. Let's hear from Pharmacist Ajayi.
Oh, good afternoon, everyone. Thank you for having me. Before answering my question, may I crave your indulgence? Even to appreciate Acquire. Thank you so much for building capacity. Because when I listen to the like of Dr. Chris and other cohorts that you have trained yesterday, I felt excited. I felt, okay, we are at the verge of achieving that goal for Africa, because more champions are being raised. And when you have more champions, you are very close to your success story. So back to the question. Coaching and mentoring is it plays a critical role in driving quality improvement. From the practical aspects of it now, I started my journey as a QI mentor in year 2015. Just as I was introduced, I'm a pharmacist. And in pharmacy practice, we are aware of quality control and quality assurance. We have a slogan that quality is built into a product, it is not inspected into it. But I never had a glimpse of what quality improvement was all about until 2015. And what gave me that advantage was because of the passion I had to deliver quality, not knowing that I don't even have the methodology. I don't even have the baseline. But luckily enough, I got trained by HLA, by HSDF, in a quest for knowledge. I went for MBA, and specifically in health management. And quality improvement was a course on its own. So I was trained by quite a number of people, professors, and I came to realize that without coaching and mentoring, the likelihood of achieving quality improvement in our facility might be next to nothing. Why? It's beyond training. Dr. Lauren told us yesterday that we need continuous learning. And if we need continuous learning, who is that person that will provide that continuous learning? Who will be there? Who will be available to ensure that the training, in quotes, the cohort that the acquired people are imparting, the training they are imparting in the respective cohorts, who will be there to do the practical aspect of it? Theory is different from the practical side. When you get to the field, that is when you will know whether you can apply those methodology or not. So, to me, without coaching, you might find it, and mentoring, we might find it difficult to achieve that goal. Just like the professor have said, there's a difference between coaching and mentoring. But in quality improvement, there's a meeting point for the two of them. So when you want to mentor, you want to build yourself in that person. You want to ensure that you teach that person the stepwise approach in doing things, and you watch the person do it. But in coaching, she has really differentiated between coaching and mentoring. But I just want to emphasize that it is key for us, important for us to note that we need mentors in our various facilities, and we need coaches in our various facilities to be able to achieve our goal of achieving positive healthcare outcome. And it would be nice for us to take that route.
Thank you very much. Yesterday, we discussed a lot about the capacity of healthcare workers to actually implement. We've had Pharmacist Ajayi talk about the first time she came across what quality improvement was. We had many people who, even the previous panel, talk about when they came across, when they had it on job, during work. They interacted with quality, what quality improvement systems are while already in service. Prof. Bukusi, I'm looking at you because of your academic, your input in academia. Talk to us about the importance of having pre-service. Yeah, now we are talking about, we are QI leaders in this panel and in this room and in the online platform, but we have many healthcare workers coming on board, and we would like them to be a little better at their capacity to do this. And talk to us about how we can use training and we can use the coaching and mentorship approach to build that capacity.
Thank you very much. You know, the other day I looked at a shelf that I have at home that had a lot of books. And when I looked at the books, I realized I had anatomy books from my first year. And I asked myself, why am I keeping these books? Who is going to read them? Are they still useful or have they become obsolete? Now, this is the importance when it comes to issues of training. Things change. And I doubt that a medical school textbook that I used now close to 40 years ago is going to be very useful at this point in time. What we need to realize is that because things change over a period of time, and in the panel just before this, I think the one before, people were talking about now with AI, you get patients who have already gone and looked up 1 million symptoms and 1 million different options before they even come to see you. So one cannot practice in the way that one may have practiced 5, 6, 10 years ago. Now, in the same way, when we talk about medical curricula to train the current level of individuals who are providing healthcare, that needs to change. The challenge is we stay with curriculum without revising them and without thinking about what does a healthcare worker in this space need. This is where quality improvement comes in. That we need to ask ourselves, what are the skills and what are the competencies that these individuals need? What do we need to incorporate? And when we're incorporating it, do we do it as pre-service when we can? And if we can't catch them before they leave, what do we do to ensure that as they're getting out of our training institutions, we adequately equip them? So the aspects that I would think about, because I've been passionate about the issues of ethics, bioethics, clinical ethics, research ethics, that's an area we're doing a lot of catch-up in. But quality improvement is another one. And we need to recognize that the stakeholders start all the way from the people receiving the care themselves, to the individuals we are training, to those who are training them, and then to those who are practicing. And at all these different levels, we need to be able to capture and ensure that we're providing adequate knowledge and skills and competencies to allow them to.
Thank you very much. And Pharmacist Ajayi, you are a certified QI coach. You have had recognitions for initiatives. Tell us a little. We said this is storytelling, so give us an initiative that you're proud of, how you have come to be at that level of being a QI coach, and so that someone can learn from that journey.
Fantastic. Thank you so much. I have been awarded a lot of things, as in I've won a lot of awards, not because I wanted to, but because of the passion. So mentoring and coaching empower people. And when people are empowered, the people you empower today might be your voice tomorrow. The people you coach today might be the one that will save you tomorrow. I give you a story. The very first story is something that motivated me. And what was it all about? I was at one of our facilities, a secondary care facility, doing what I love doing most. Passionate about delivering quality services to people and training people, bringing in, people of like minds without any financial motivation. When I started, there was no financial motivation, but the fact that avoidable death could be prevented was what really motivated me. So just continue to strive for excellence, doing it bit by bit, following methodologies as I was taught. Lo and behold, I left that facility because I was posted to another facility, not knowing that my mom would assess that facility. My mother was not in Nigeria as at the time I was moved out. She was in US. So I didn't know, she didn't have diabetes from inception, but maybe after spending like 6 months over there, she developed diabetes, and I didn't know that she was going to come back home with diabetes. So she came as an emergency case to the facility that I left. They didn't know she was my mom because she was semi-unconscious. But because of the structure that was on ground, having done the quality improvement projects in that facility, just a little of reducing the waiting time of patients. My mom was attended to. She gained her consciousness, and she later called me that I'm at so-so-so hospital on admission. I rushed down. But lo and behold, I didn't lose my mom. Why? Because of the impact that have been done. That's one. The second aspect of it was that in one of our facilities too, this quality improvement journey is not as easy as we think. And that is the more reason why mentors should please be effective. We should bring up mentors that will encourage other people, that will empower other people. There was one of our nurses who did not really believe in, doing it. Who believed that, okay, we can continue to do the same thing, same way, and get a different result. So lo and behold, she didn't join us. she was like, no, I'm in so place. I didn't really want to mention it so that, of course, she might be online. So she didn't join us. So, and I believe in this Pareto's principle. And what does it say? It says 20% of your workforce will achieve your 80% of what you desire, your desired outcome. So we kept at it. We're doing it. Before you know it, the husband of that particular nurse had an accident and was brought into that facility, also in an unconscious state. But because of that simple project that has been done previously, we did it. That also motivated me. Then again, the Bill Gates thing that I talked about. Wow. When I was posted to Massey Street Children's Hospital, I was invited by Next 360. You know, they invited me not as a mentor. They felt, okay, there is new initiative in Nigeria. Quality improvement is the new thing that everybody has to be aware of. And we are, children's hospital. So they felt, let's invite a quality person. But they thought I was still at the level of, learning. Quality improvement is evolving. So I'm not saying that. I'm only saying that if you keep at it and you develop interest in it, is a way to go. So when they invited me for their programs, the facilitator, they were facilitating, and by the time we broke up into sections and I gave my input, they were like, wow, who are you? So they needed to know more about me. So they sent in 2 representatives to my facility to ask me about quality. Did I have any knowledge in quality? I said yes. That I've been trained in quality improvement. I have my certification, and the quest for knowledge also made me to, explore other things that will make me to function effectively well in that field. So I did SPSS certifications, trying to just build on it so that I could do it right. And also when my people, my mentees and my coachees are asking me questions, to be relevant. Lo and behold, before you know it, they gave me an assignment to do. And I did that assignment. It wasn't only my facility. In fact, Tanzania was there, Uganda, just African countries where Next 360 initiative was being implemented. And as God will have it, I imagine, Bill Gates was not in Nigeria, so the thing was sent, the quality improvement assignments and monitoring tools was sent to him. And was like, he would like to visit Massey Street Children's Hospital. I was like, what did I do differently? So before knowing anything, they sent me a kind of letter to get my profile, blah, blah. Before Jack Robinson, he came visiting, and I was privileged to be among the team that welcomed him. It was only 3 of us, but luckily enough for me, I happened to be the only QI mentor, and then they now enlist me to be a QI facilitator for Next 360 initiative in Nigeria. And I've also won a state award as best mentor for year 2021. So those things have motivated me, making me to forget the pains that I've suffered at the initial level. Because the people that are being trained now, I just want to encourage you. It is not an easy task, but when there is a will, there is a will. And people should come up with strategies, innovation, because QI is evolving to train other people. Why? Because we will not be on that seat forever. I wasn't a director when I started my QI journey. I was just a level 12 officer. Now I'm a director. In no time, I will retire. So if I don't lay a good legacy, who will continue the job? And we are all potential patients. So that's my story, a summary of my story. I still have quite a lot, but because of the logistics.
Fantastic, fantastic. That's an invigorating story. And yes, there's nothing better to, to bring in passion than a personal experience, right? Why is it important, Daktari, to bring to the next generation? Why is it important to be passing on to the next generation? Or because she mentioned even that she will retire at some point. Why is it important that we pass on knowledge from one to another?
I think it's been said so clearly, I can't say it any better. And I like what you've said, that we are all potential patients. You know, 100 years from now, none of us are going to be here. Assuming the world is still going on and the world hasn't ended, none of us are going to be here. So the importance is each one of us, potentially, we may be healthy today, we may be fine today. Tomorrow, you don't know if you're the one who's going to need those services. But why is it important to pass it on? If you die with all of us will die at some point in time. But if you die with that knowledge, with that information, it is entirely useless because it will not be of any use to anybody else. The importance of passing on information and passing on training and mentoring and coaching is because that perpetuity is very important. And others can improve on what I have done and do it even better. Because as knowledge continues to be generated, then we think about what else do we need to do? How else do we need to do it differently? So it's a critical part of the continuity that's needed for general improvement and for people to be able to do better than what was done yesterday.
Thank you very much. I think at this point, I'm looking at the room to take a question. A question for Prof, a question for Pharmacist Ajayi, because she was the first one. I'll let her do it, and then one more here.
Thank you so much.
Then Ruth Pal, maybe Ruth Pal will also give us a question online, a question or two, just a summary of them.
Thank you, online people. We are really glad that you're still with us. So I think everyone is just saying this is very enlightening, educative, saying I'm glad I attended the webinar. So let's go to the bottom. I saw a question. It's very good to train others to sustain what we have achieved. In mentorship is a big role. So is there a way we can get a recording of the meeting? Well, obviously we will be sending it to everyone who has registered or is in the room. You'll get a recording. So we don't really have, we just have good comments about healthcare professional trainings being needed, quality improvement needing to be embedded in the training. So a lot of really good comments. Let me return it back to you.
All right, thank you, Asante online team, for plugging in.
Yeah, thank you so much, Professor. I'm so glad to see you. I think I'm one of the beneficiaries that you have mentored under KEMRI Research, and I'm so excited, and thank you so much, Pharmacist today. My name is Grace. I realized I didn't introduce myself. I'm Grace Nyamboro. I'm a quality improvement advisor with LVCT Health. And probably my question will go to you, Prof, and what would you advise the current situation when you look at our healthcare systems when it comes to support supervision and also the aspect of mentorship and coaching? Because these things are so mixed up in that now mentorship and coaching has been brought more into a quality assurance perspective and very little to do with quality improvement. How then do we give this balance and probably have kind of indicators linking improvement efforts as a result of mentorship and coaching? Yeah, thank you.
One more here, just one.
Thank you so much, our panelists. Dr. Herbert from Uganda is my name. I really like, Professor, your contributions in terms of coaching and mentorship. But my particular issue is about employees. When we're employing these new staff, in regards to quality improvement and in regards to orientation and induction, I think we need to have a mechanism of how we incorporate this in our orientation and induction And such that if I'm a new staff, I know that when I'm going to join this organization, this is its culture, and this is what we are doing. And in that way, as I enter the system as a new staff, I'm able to cope up with what is in that system, so that the issue of the legacy and maintaining continuity remains. We've seen in most of the cases where we employ people, but we find we just employ and we say, your duty station is ABCD, and you're going to do this and this, and over there start. But I think in this issue of quality improvement, we need to think and say, now, how do we bring in the issue of quality improvement in terms of orientation and induction in our systems? Personally, when I started service, and the issue of quality improvement started in, nobody told me about quality improvement. But all of a sudden, they were, yes, we're doing quality improvement, and the issue was 5S and documentation journal. And that's what I knew, that I think those are the issues. But again, deep, I realized it's beyond that, because it involves patient, it involves the leadership, it involves so many things. And I think if this is the fora as leaders, if you're going to employ someone, are you ready to incorporate the culture of quality improvement from the start or from the word go, so that we move the journey together? Thank you so much.
Thank you so much. Let me respond to the second question. You know, when there is a will, there is a way. When you have a will to do something, there is always a way. And just like leadership is about influence, so also mentorship and coaching is about influence. And what does that influence, what does it mean? The I stand for your integrity. If you are doing it right all the time, people will want to emulate you naturally. People love good things. They love good leaders. But the integrity first. And it's not about the quality improvement alone. If you have to mentor anyone or be a coach to anybody, the integrity is key. Then you need to nurture people. You find there is need for them to be orientated, to get orientated into your system. But when they get into the system, it is important that we nurture them. They are new. They are coming afresh. You don't know their set mind, their mindset. So you need to nurture them, tell them the rules and regulation of your organization in a friendly manner. You nurture. Then the F, the fact that they are coming afresh into the system does not mean they are naive. So there is need for you to have faith in the new employee. If you have faith in them, that means you trust them. In the first instance, it's because they were trusted. That was why they were employed. So we can't say they cannot learn. Then L is you listen. As a good coach or a mentor, you need to listen effectively well. Listen to people's opinion. You will identify your champions. Not everybody will align with you, because it's not everybody that will come on board. We don't learn at the same pace. So we'll listen attentively to them. Understand that we need to understand that people don't learn at the same pace. So in a bid to mentor or to coach anybody, we need to come down to their level. Understand that they don't learn at the same pace. Exemplary leader. Whatever you profess should be what you should do. Do as I do. If I tell you we need to do this project, I should be seen to be collecting data while you are collecting data. Why? Because it's an hands-on holding thing. I'm holding your hand to do it right. I'm building myself in you. I'm empowering you to do it better than me, just as the professor has said. So you understand that they don't learn at the same place. You ensure that you listen effectively to them. So be an exemplary leader. Then, in no way, communicate effectively. As simple as do not do this thing. So what is that thing that I need not to do? Okay, PDSA. You plan, you do, you study, you act. You take it one after the other, as if that person is not a graduate. In mentoring, you don't assume that this person ought to have known this. No. You take it like a baby step. The plan is this. So this aim statement has to be smart. I say, don't assume that, is he not a professor of ops and gynae? Smart means this, my S is specific. The specificity you need to define. M is measurable. So you do it that stepwise way. Before you know it, you see people, champions, wanting to be like you in the system. Why? Because excellence have a lot of friends. Everybody wants to associate with somebody that wins award almost every time. While I was at one of our facilities, the facility was the best in the whole of Lagos State. Do you understand? So, and they say, Farmer Ajayi, how do you do it? It's not about me. It's about the team. But because I've been opportune to drive the initiative, everybody will see you as a good leader. But that does not mean I don't have my weaknesses too. And understand that in a team, we have varieties of things that needed to be done. Do you understand? And at the end of the day, together everyone achieves more. So those people that are coming afresh, they can really do it even better than we are doing now. Thank you.
Thank you.
I'm not sure I'll be able to answer your question comprehensively, but allow me to think a little bit out of the box and say, I think the greatest need that we have is to think out of the box. There's a lot within the medical care space that is relatively fixed, relatively decided, and we know that this particular medication works or this way works, and we need to give it or do it or perform it in a certain way. But for so many of our processes, there's opportunity to do differently or to do more. So when I wear my medical practitioner's hat, it's a different hat from when I wear my research hat. And I think more often than not, I would say we need to have the open mind that people bring into the research world that says, what can we do differently? It speaks a little bit to the question that was asked about new people coming in. Sometimes we are very inflexible and not open to knowing what do you do differently. We say a new broom sweeps cleanest. When people come into the system or when people are introduced into any healthcare facility, they may see things that we are doing that are not right. I want to take the Kenyan Gen Z as an example right now. They're saying, this can't be business as usual. We can't keep doing things the way we've done them. We need a difference. It's because they have a different mindset. For many of us, we've also almost settled into, well, this is how it's always going to be. So you accept. Someone tells you something's not going to work, you try to figure out how to work around it, rather than, can we change a system and do differently? So I think coming to the space with an open mindset that then says, what can we do differently? There are things that we know, absolutely, perhaps there are things we can't change. There are certain things we have to monitor, but there are things we can change. Can we differentiate between what is a relatively fixed way and what is a potentially open way to improve systems and to improve the way we do things so that we can make a difference? And if we have that open mindset that doesn't look at who are you, what are your qualifications, what do you bring to the table, but what is the value you are adding to this space, then I think we'll be able to do differently.
I think fantastic. Let's put our hands together and give a very warm round of applause. We can all agree we can't just have enough of it. And that's why someone said we need to have this on an annual basis. We need to keep doing this. We need to keep hearing. We need to keep discussing and agreeing and giving examples. This year it's Gen Z, maybe next year it's something else. But thank you. One more round of applause for Ajayi, who came from far, and Prof, who has a wealth of information. Let's thank them.